If you make just one of these mistakes tonight, your brain may not recover by morning, and most people your age make at least 3 of them without realizing it. I know that sounds alarming, but stay with me for a moment, because what I'm about to share could genuinely preserve your mind. Tonight, I'm going to show you the silent mistakes that happen while you sleep, the ones that don't cause headaches, don't trigger confusion during the day, and don't give warning signs. And more importantly, I'll show you how to fix them before your head hits the pillow. Let me start with a story that still haunts me. A woman in her early 70s came into my practice for what seemed like a routine cardiac consultation. She was sharp, articulate, still managing her own finances, and she described her memory as pretty good for someone my age. Her heart was stable, her blood pressure controlled. When I asked about her sleep, she laughed and said, "I sleep like a rock, but I wake up feeling foggy. Isn't that just part of getting older?" That dismissive attitude right there, that acceptance of mental decline as inevitable, is more dangerous than most people understand. 6 months later, her family brought her back to my office. She was still the same warm person, but something fundamental had changed. She struggled to remember our previous conversations. She couldn't recall taking her medications that morning. Her daughter whispered to me afterward, "It's like she aged 5 years in 6 months." Here's the truth that medical schools barely touch on, and most cardiologists don't explain clearly enough. Your brain is not safest when you sleep. In fact, for many people over 60, nighttime is when the brain faces its most dangerous kind of deprivation. Not the obvious kind you notice during busy days or stressful moments, but the quiet kind, the kind that accumulates slowly, silently, while you're unconscious. Blood flow patterns shift, oxygen delivery changes, waste clearance slows, and small, seemingly harmless sleep habits can suddenly become brain damaging when combined in the dark hours. I'm Dr. Robert Harrison, and for decades I've studied the connection between cardiac health and brain preservation. I've reviewed thousands of cases involving nighttime oxygen drops, circulation problems during sleep, and cognitive decline that accelerates mysteriously after age 60. And what I can tell you with absolute certainty is this: most cognitive decline is not inevitable. It is the result of preventable nighttime mistakes. Mistakes people don't even know are stealing their mental sharpness. The first one is incredibly common, and almost everyone believes they're being responsible. The first mistake is avoiding all fluids after dinner to prevent nighttime bathroom trips. This sounds practical. It feels considerate of your sleep quality. But inside your brain, something very different is happening. When you're dehydrated, your blood becomes more concentrated. That makes it harder for your heart to deliver oxygen and nutrients to your brain efficiently. Your cerebral circulation slows, your blood pressure regulation becomes erratic, and your brain's waste removal system, which depends heavily on fluid flow, starts to fail. During the night, especially between 2 and 6 in the morning, your brain naturally goes through critical cleaning cycles. These cycles remove toxic proteins and metabolic waste that build up during waking hours. But this system requires adequate hydration to function properly. I've had patients tell me they stop drinking water after 6 p.m. because they want uninterrupted sleep. What they don't realize is that they may be interrupting their brain's most important maintenance work instead. This doesn't mean you should drink large amounts right before bed, but completely avoiding fluids for hours before sleep is silently damaging your cognitive future. A small glass of water, about half a cup, 45 to 90 minutes before bed, can make a crucial difference. It helps maintain the fluid flow your brain needs during its most vulnerable hours. But here's the critical part. Hydration alone won't protect your brain if you're making the second mistake, which has to do with how gravity affects your mind while you sleep. The second mistake is sleeping completely flat when your brain needs better circulation. Lying completely flat feels natural. It feels restful. For years, many people have slept that way without questioning it. But as we age, the brain's circulation becomes more sensitive to position, and flat sleeping can reduce the blood flow your brain desperately needs at night. When you lie completely horizontal, It becomes harder for your heart to pump blood uphill to your brain against gravity. This is especially problematic for people with high blood pressure, heart rhythm issues, or even mild circulation problems they don't know they have. Let me ask you something important. Have you ever woken up feeling mentally foggy, confused, or like your thoughts were moving through molasses? That's not just sleep inertia. That could be your brain recovering from hours of reduced blood flow. I once had a patient who instinctively slept with extra pillows. When I asked why, she said she didn't really know. It just felt better. Her brain had figured out something her conscious mind hadn't. Slight elevation helped optimize blood flow to her brain during sleep. She wasn't being fussy. She was compensating for a circulation issue. Even a gentle incline, just 4 to 6 inches, can significantly improve nighttime brain perfusion. You don't need to sleep sitting up. You don't need expensive, adjustable beds. Even a slight angle can help your cardiovascular system deliver what your brain needs most. But even perfect positioning won't protect your cognitive future if you're making the third mistake, which is one of the most overlooked and brain-damaging ones of all. The third mistake is taking sleep aids that secretly rob your brain of oxygen. Sleep medications are everywhere. Over-the-counter pills, nighttime pain relievers, prescription sleep drugs, even natural supplements are often seen as harmless brain helpers. But many of them can suppress breathing, reduce oxygen levels, or disrupt the deep sleep stages when your brain does its most important repair work. I've reviewed countless cases where someone's memory started declining gradually, and when we looked deeper, we found that a nighttime medication was slowly but steadily reducing their brain's oxygen supply. The most insidious part is that these effects are invisible. You don't wake up gasping. You don't feel brain damage happening. Your cognitive function simply erodes night after night. People often tell me, I only take it when I really need sleep. But sometimes, even occasional use can start a dangerous pattern, especially if you snore, have sleep apnea, or wake up feeling unrested despite sleeping for hours. This is why it's crucial to ask a very specific question about any nighttime medication. Not just, will this help me sleep? But, will this protect my brain while I sleep? If the answer isn't definitively yes, that's a warning sign. But medication isn't the only brain threat people overlook at night. The fourth mistake has to do with symptoms people have learned to accept as normal aging. The fourth mistake is ignoring nighttime breathing problems that are starving your brain. Humans are remarkably good at normalizing dysfunction. We tell ourselves that snoring, gasping during sleep, restless nights, or waking up mentally exhausted are just part of getting older. But your brain doesn't adapt to oxygen deprivation the way your expectations do. It tolerates low oxygen until it can't maintain normal function anymore. Loud snoring, breathing pauses during sleep, waking up with headaches, morning confusion, or persistent mental fatigue aren't just sleep annoyances. They are signs of nighttime brain oxygen starvation. One of the most devastating and underdiagnosed conditions related to this is sleep apnea. Sleep apnea causes repeated drops in brain oxygen during the night, forcing your cardiovascular system to work harder under low oxygen conditions, while your brain struggles to maintain basic functions. Over time, this dramatically accelerates cognitive decline, memory problems, and even dementia risk. What makes it so dangerous is that many people don't know they have it. Their partner notices the snoring or breathing interruptions, but the person sleeping has no memory of suffocating dozens of times per night. I once asked a patient why she never mentioned her loud snoring. She said her husband complained about it constantly, but she assumed it was just annoying, not dangerous. It wasn't just annoying, it was stealing her cognitive future. Once she was diagnosed and treated, her morning mental clarity improved dramatically. Ignoring nighttime breathing problems doesn't make you stoic. It makes your brain vulnerable to irreversible damage. And all of this leads us toward the final mistake, the one that connects everything and often determines whether your brain truly recovers during sleep or continues deteriorating night after night. But before we get there, Let me say this clearly. None of these mistakes feel brain damaging in the moment. That's what makes them so destructive. They don't cause immediate confusion. They don't trigger obvious alarm bells. They simply set the stage for gradual cognitive decline that people mistake for inevitable aging. Now we come to the final mistake, and in many ways, this is the one that determines whether all the others become brain damaging or not. Because even if you hydrate properly, sleep at the right angle, avoid risky medications, and address breathing problems, there's still one thing that can quietly undo all of that protection. And it's something most people believe is just part of modern life. The fifth mistake is going to sleep with a stressed, overstimulated mind. Most people think of mental stress as a daytime cognitive problem: work pressure, family worries, financial concerns, disturbing news, relationship conflicts. But what very few people understand is that the way your mind enters sleep determines how well your brain can repair itself for the next 6 to 8 hours. If you go to bed anxious, angry, mentally racing, or emotionally activated, your nervous system doesn't just power down when you close your eyes. Stress hormones like cortisol and adrenaline remain elevated throughout the night. Your brain activity stays higher than optimal. Your blood pressure doesn't drop the way it should. And your brain never gets the deep, restorative sleep phases it needs for memory consolidation and toxic waste removal. I've seen this pattern repeatedly in my practice. Patients with normal daytime cognitive tests, but accelerated nighttime brain aging that shows up months or years later. When we examine their sleep patterns closely, the common thread isn't always diet or exercise. It's unresolved stress and mental overstimulation carried directly into sleep. One patient told me, "My mind won't shut off at bedtime. That's when all my worries get loud." That's exactly when her brain was missing its most critical repair opportunities. Your brain is designed to shift into maintenance mode at night. That's when memories get filed properly. That's when cellular repair happens. That's when toxic proteins get cleared out. But it can't do this essential work if your mind is replaying conflicts, scrolling through alarming news, or lying in bed with racing thoughts. From the brain's perspective, stress doesn't distinguish between physical threats and mental ones. The physiological response is identical. This is why cognitive decline, memory problems, and even early dementia symptoms often accelerate during periods of chronic stress or poor sleep quality. The brain has been working all night without real recovery time. Eventually, function starts to suffer. And the tragedy is that most people never connect their bedtime mental state to their daytime cognitive performance months later. Now, here's the encouraging news, and this is crucial. This mistake is one of the most correctable, and it doesn't require prescription drugs, expensive equipment, or major life overhauls. It requires a commitment to create a mental transition zone between your active day and your restorative sleep. Think of it as giving your brain permission to shift into repair mode. A simple wind-down routine, even 15 to 30 minutes, can dramatically improve how well your brain recovers overnight. No heated discussions, no problem-solving conversations, no news consumption, no stimulating television or social media that keeps your mind alert and reactive. Dim the lights gradually. Slow your breathing intentionally. Sit quietly. Do gentle stretches. Read something calming. Practice gratitude. Or simply breathe slowly and deeply with your eyes closed. When your breathing slows and deepens, your brain waves follow suit. That's not wishful thinking. That's measurable neuroscience. I often tell patients to create a mental ritual before sleep, silently saying, "My mind is safe now. My brain can rest and repair." It sounds overly simple, almost naive, but the nervous system responds to consistent signals, not complicated logic. Calm, repetitive signals produce measurably calmer brain states. Now let's step back and look at the complete picture, because this is where everything connects. None of the 5 mistakes we've discussed are dramatically dangerous on their own. That's what makes them so insidious. They don't feel like cognitive emergencies. They feel like reasonable habits: avoiding evening fluids, sleeping flat, taking something to help you rest, ignoring snoring, carrying daily stress to bed. Each one quietly reduces nighttime brain protection. And when several of them happen together, night after night, month after month, the brain eventually shows signs of accelerated aging. The people who experience sudden cognitive decline are rarely making obvious mistakes. They're not ignoring dramatic warning signs. They're simply doing what they've always done, unaware that their nighttime habits are slowly compromising their most precious asset, their mental clarity. And that's why awareness matters so profoundly, because once you understand what puts your brain at risk during sleep, you can make small adjustments that have enormous protective effects. So, let's make this actionable tonight. Before you go to bed, implement 5 simple brain protective strategies. Ensure adequate hydration earlier in the evening, not enough to disrupt sleep, just enough to support your brain's nighttime circulation and waste clearance systems. Adjust your sleeping position so your upper body is slightly elevated, especially if you've ever experienced morning mental fog or confusion. Take a careful look at any medication or supplement you use for sleep, and verify that it supports rather than compromises your brain's oxygen supply and sleep architecture. Pay serious attention to any nighttime breathing problems you've been dismissing as normal aging, and consider evaluation for sleep disorders. And finally, create a calm, predictable transition into sleep that allows your brain to shift into its essential repair mode. These are not extreme interventions. They are gentle corrections that work with your brain's natural nighttime needs rather than against them. I want to leave you with one final thought, and it's something I wish more people understood before cognitive problems become obvious. When brain damage happens during sleep, there are no immediate symptoms. There is no pain to warn you. That's why prevention matters infinitely more than trying to reverse damage later. The brain doesn't announce when it's struggling. It simply compensates until it can't anymore. But the opposite is equally true. When you support your brain properly during sleep, it becomes more resilient during the day. Better sleep improves memory consolidation, enhances mental clarity, reduces inflammation, and actually helps prevent age-related cognitive decline. Nighttime brain care isn't separate from cognitive health, it's the foundation of it. So here's my question for you, and this is important. Which one of these mistakes sounds uncomfortably familiar to you right now? Not which one worries you the most, but which one made you think, that's exactly what I do every night. Take a moment and be honest with yourself. If this video changed how you think about protecting your brain while you sleep, I want you to do one more thing. Share it with someone whose mind you want to see stay sharp, a spouse, a sibling, a close friend. Because the most dangerous brain mistakes don't happen during busy days. They happen quietly in the dark while we sleep, thinking we're doing nothing that matters. And sometimes, awareness is the only thing standing between a sharp mind and unnecessary cognitive decline. Which mistake will you fix tonight?